All right, this is Consciousness, Section D lecture. Our prioritized standards are 7A. Objectively, we're going to evaluate the impact of substance use and abuse on consciousness. While people all experience altered states of consciousness in the form of sleep, some people use drugs and other substances that result in altered states of consciousness. A person who has a substance abuse disorder often uses more of a substance than they originally were intended, and continues to use that substance despite experiencing significant adverse consequences. Individuals diagnosed with a substance use disorder often have a compulsive pattern of drug use that is associated with both physical and psychological dependence. Now, physical dependence involves changes in normal bodily functions where the user will experience withdrawal from the drug if attempting to quit use of the drug, as where psychological dependence involves an emotional need for the drug and may use the drug to relieve psychological distress. Those suffering from physical dependence often experience tolerance, which occurs when a person requires more and more drug to achieve the effects that were previously experienced at lower doses. Now, tolerance can cause the user to increase the amount of the drug used to a dangerous level, possibly to the point of overdose and death. Now, attempts to quit a drug often result in withdrawal, which include a variety of negative symptoms experienced when the drug use is discontinued. Things like nausea, pain, tremors, crankiness, high blood pressure. Now, there are four primary classes of drugs. You can have stimulants, depressants, opioids, and hallucinogens. Stimulants are drugs that increase the functioning of the central nervous system. Many stimulants act as agonists, which are aids, of the dopamine neurotransmitter system. Stimulants temporarily elevate alertness, mood, and awareness. As dopamine activity is often associated with reward and craving, stimulants that affect dopamine neurotransmission often can lead to abuse. Caffeine is the most widely used stimulant drug that is found in things like coffee, tea, chocolate, many soft drinks, and several over-the-counter drugs. While caffeine has several positive effects, such as increasing energy and mental alertness, heavy use can cause insomnia, agitation, muscle twitching, nausea, and irregular heartbeat. Caffeine is physically addictive, and withdrawal symptoms include headaches, fatigue, and irritability. Now, nicotine is a stimulant drug that is the active ingredient in tobacco, which is associated with increased risk of heart disease, stroke, and a variety of cancers. The harmful effects of nicotine are now known well, but many people continue to smoke or chew tobacco in spite of warnings. Now, vaping nicotine is increasingly a problem among teens and young adults, as they have more nicotine than tobacco products and are thus more addictive. There are several other types of stimulants, with some of the most addictive and dangerous being cocaine and methamphetamine. So cocaine is a stimulant drug that produces euphoria, energy, power, and also pleasure. It can be snorted, it can be injected intravenously, it can be smoked. When it's smoked, it's in a crack form. Methamphetamine is a synthesized, meaning it's made in a laboratory, a synthesized stimulant drug that increases activity, decreases appetite, and provides euphoria. Now, generally, the effects wear off relatively quickly for methamphetamine, which leads to the desire to consume more of it to maintain the high. Also, after the initial rush, it is often followed by a state of high agitation that can lead some to actually act out violently. Sometimes methamphetamine is referred to as speed when it's in pill form, meth, or sometimes just called crystal meth, among other names. Depressants are drugs that tend to suppress central nervous system activity by serving as agonist to the GABA, or gamma aminobutyric acid, neurotransmitter system that has a quieting effect on the brain. Now, alcohol is a depressant drug that is a chemical resulting from the fermentation or distillation of various kinds of vegetable matter. So essentially like rotted vegetables and fruits. Alcohol is associated with decreases in reaction time and visual sharpness, diminished alertness, and a reduction in behavioral control. Many mistakenly believe that alcohol is a stimulant due to the reduction in behavioral control, but it's actually a depressant. Now, the use of alcohol results in a variety of changes to consciousness. At low doses, alcohol use is associated with feelings of euphoria, but as the dose increases, it leaves the person feeling sedated, essentially being tranquilized. With alcohol intoxication, a person may experience a complete loss of consciousness and or difficulty remembering events that occurred before the intoxication. Alcohol abuse is associated with things like alcohol poisoning, alcoholism, also fetal alcohol syndrome. So when people talk about a drink, they're talking about an ounce of alcohol in a drink, although there is more percent alcohol in different types of drinks. So beer has between 4 to 5% alcohol usually, a 12-ounce can. If you have a 4-ounce glass of wine, about 12% alcohol. So that would be like 3 cans of beer. If you have a shot of most liquors, that is between 40 to 50% alcohol. So that'd be like having 10 cans of beer. So depending on the beverage you're having, it could possibly cause your blood alcohol level to increase much more dramatically depending on the type of alcohol that it was. Other common depressants include barbiturates and benzodiazepines. Apologies for not knowing my drug names. Now, barbiturates are depressant drugs that have a sedative effect, as where benzodiazepines are depressant drugs that lower anxiety and reduce stress. Now, opioids are drugs that tend to decrease pain and produce euphoria by serving as agonists for the endogenous opioid transmitter system. So the opiates are natural opioids that are derived from opium. So opium is a naturally occurring compound found in the poppy seed from which all narcotic drugs are actually derived. So if you ever had a poppy seed muffin, as a for instance, they have the same thing that's used in opium. So it is possible that sometimes people fail drug tests because it looks like they took opium when they really just had a poppy seed muffin. Now, narcotics are opium-related drugs that suppress the sensation of pain by binding to and stimulating the nervous system's natural receptor sites for endorphins. Due to the pain-killing properties of opioids, those have an extremely high potential for abuse, especially morphine and heroin. Morphine is a narcotic drug that is used chiefly in medicine as a pain reliever and sedative. It's commonly used in end-of-life situations where nothing can be done but attempt to reduce the pain for the patient. Heroin is a narcotic drug that produces intense feelings of euphoria and pleasure that are amplified when they are injected intravenously. So for 4 to 6 hours, users experience alternating states of consciousness and semi-consciousness. Not only is it likely the most dangerous type of opioids, but it's also one of the cheapest sources of opioids, which expounds its abuse. Opioid abuse has become a global crisis, as there are between more than 26 million to I think about 34 million people worldwide, and over 2 million Americans suffering from substance abuse problems related to opioids. Nearly 500,000 U.S. adults are addicted to heroin, as for instance, leading to nearly 17,000 deaths in the U.S. in 2010, which used to be a big number for coronavirus. Hallucinogens are drugs that can result in profound alterations in sensory and perceptual experiences, where users often experience vivid visual hallucinations, hallucinations of body sensations, so like a feeling that maybe you're a giant, and skewed perception of the passage of time, with hallucinogens being incredibly varied in terms of the neurotransmitter systems that they actually affect. So, marijuana is a mild hallucinogen drug derived from the leaves and flowers of a particular type of hemp plant, sometimes referred to as pot or weed. It can be smoked or eaten. Now, medicinal uses of marijuana have been found as it can be used to treat several conditions, and several states have legalized it for recreational purposes. Like, for instance, it can reduce nausea and vomiting during chemotherapy, so beneficial for cancer patients. It can improve appetite in people that have HIV or AIDS. It reduces chronic pain and muscle spasms. It can help treat severe forms of epilepsy, also beneficial for glaucoma patients and other types of disorders. While several states have actually legalized it for medicinal and recreational purposes, marijuana production and usage still actually violates federal law. In addition to hallucinations, marijuana has been found to cause paranoia and anxiety, especially in adolescents. Now, teenagers and young adults who use marijuana regularly are at risk of significantly altering the structure of their brains, as it appears to permanently damage developing brain cells. Now, there are several other intense synthetic hallucinogens, like LSD, sometimes called acid, PCP, sometimes called angel dust, MDMA, which is technically an amphetamine, which is referred to as ecstasy or Molly. All right, that concluded Consciousness Section D lecture. Our prioritized standards again were 7A, and objectively now you can evaluate the impact of substance abuse or use and abuse on consciousness.